Hi, my name is Dr. Eric Miller. I'm with Chiro-Med Health and Wellness Centers in Orland Park, Illinois. Today's topic is going to be basically debunking myths about chiropractic and the chiropractic profession. I've been practicing for 25 years. I've treated over 20,000 patients, and I've done over 1 million chiropractic adjustments throughout my career. And after seeing 20,000 patients plus, I keep on running into the same information as far as doubts, worries, concerns from patients in regards to what they've heard on the internet, or maybe they've heard from a family friend or someone that's basically just giving misinformation. So today's purpose is to debunk some of the myths that are associated with chiropractic in general. The first thing that I want to talk about when we look at the 5 most common myths concerning chiropractic is the number one thing is that chiropractors are not really doctors. Number 2, chiropractic is expensive. Number 3, neck adjustments can cause strokes. Number 4, once you begin to see a chiropractor, you have to see them forever. Number 5, the only thing that chiropractic is really good for is back or neck pain. Number 1 myth: chiropractors are not real doctors. If you look at the Medical Practices Act of 1987 for Illinois, they define physician. And there are 4 physicians in the state of Illinois. You've got the medical doctor, you've got the doctor of osteopathy, you've got the osteopath, and you've got the chiropractic physician. So there are 4 different physicians according to the Medical Practices Act. And let's start with the number 1 myth concerning the chiropractic profession. The number 1 myth is really that chiropractors are not real doctors. According to the Medical Practices Act of 1987, there's a definition of 4 types of physicians. The first is the medical doctor, the second is the osteopathic physician, the third is an osteopath, and the fourth is a chiropractic physician. All of the physicians undergo rigorous undergraduate studies, medical studies in their curriculum, post-grad, and have extensive internship. As a matter of fact, the chiropractic physicians actually have more classroom hours than the medical physicians. If we look, we see that the average chiropractor is undergoing 2,419 classroom hours, as opposed to the medical physician that has 2,047. Most of our classroom hours are relating more to biomechanics, anatomy, physiology, kinesiology, endocrinology, the same thing as the typical medical doctor does, but a little less classroom hours on pharmacology, pharmacokinetics, just things that are basically dealing with drug-related education, which we don't really use in our practice. So when you compare the actual educational requirements and exam requirements, there's very little difference between the average medical doctor and a chiropractic physician. The second most common myth concerning chiropractic is that chiropractic is expensive. And that is just a joke. Because let me tell you, after doing this for 25 years and having surgery myself, having several children that have had to go to the hospital for different things, the average cost of a chiropractic visit is $65 across the nation. And as everyone in public knows, if you go to the emergency room, your first little step into the emergency room, you're going to be hit with $500 there. If you go back for anything, you're going to be hit with another $500 as soon as you step foot in there. So my case average runs roughly between $1,000 and $2,000 to treat a case from A to Z. So that includes manipulation, physical therapy, x-rays, diagnosis, actually correcting a problem in as little as $2,000. When you compare that to, let's say, disc surgery for the lower back, you're talking about $80,000 on average across the nation. So the comparison as far as expense, there is no comparison at all. Chiropractic is the cheapest and safest and most effective form of therapy that there is. The third myth that really needs to be debunked is the myth that neck adjustments cause strokes. And unfortunately, I've heard this from several patients that are really scared, terrified about getting their neck adjustment. They'll come in, they'll be complaining of neck pain, they'll be complaining of headaches, they've got difficulty moving their head from side to side, and obviously after examination we find that there's misalignment in their neck. Their x-rays reveal that there's misalignment and that the segments actually need to be moved. The most effective way of moving the segments and restoring normal motion and alignment to the spine is with a manipulation. If a manipulation is done correctly, there is no chance of harm. As a matter of fact, the statistics actually state that it's more dangerous to get your hair washed at the beauty salon or to lay in a field and look at the stars than it is to have a chiropractic manipulation. 1 in every million neck adjustments may result in some sort of a stroke, and that particular problem usually happened because the person was going to have a stroke anyway, and the unlucky chiropractic physician that happened to do it did not check them the way that they should have, or just it was his unlucky day. But as far as stating that it's a dangerous thing and that neck adjustments can cause stroke, that's just far-fetched and unrealistic. I've done, again, probably 250,000 neck adjustments at least, and never had any bad repercussions at all. And what happens is the neck begins to move like it should, you begin to take off irritation in the nervous system, and the muscles calm down, and now the patient can actually move their neck. Let's go right into the fourth myth. The fact that when you go to the chiropractic office, you have to then go forever. Because again, I've heard that many, many times as well. The fact of the matter with this is chiropractic care generally goes through 3 different phases. The first phase is called crisis care, and that's really what usually drives patients in the office. They're in crisis, they're in pain. They've been to their doctor, they've tried the pain medication, the anti-inflammatory, the muscle relaxants, and it hasn't worked, or they don't have chiropractic from a friend or family member or past experience, and they come here because they know that it's effective. Crisis care is generally the first 12 visits. So we usually see patients 3 times a week for a month. And that's a typical physical therapy routine. If your medical doctor prescribes physical therapy or chiropractic therapy, they're going to generally write the script for 3 times a week for a month and then reevaluate. Usually within the first month of care, we're able to reduce the symptoms by at least 50%. And we consider this symptoms care or crisis management. The next phase of care, if you choose to do it, would be more active care or corrective care. Corrective care can go from 12 to 36 visits depending on how severe your problems are, and that's basically similar to working out. The final phase of care is maintenance care, and again, that's if you choose to do it. Once you've attained correction and balance, it's a good idea to go ahead and do periodic checkups just to make sure everything's holding like it should. The final myth that we want to debunk today is myth number 5, and that's the myth that chiropractic is only good for neck and back pain. Basically, chiropractic physicians are specialists in the neuromusculoskeletal treatment. So we treat anything that's related to joints. So it could be neck, shoulder, elbow, wrist, hip, knee, foot, ankle, basically all joints, all muscles, all nerves can be treated with chiropractic care, and very successfully. So in conclusion, I really hope that you find this video helpful. If you're on the fence about trying chiropractic care for a problem you may have, please feel free to call the office at 708-403-2727 for a complimentary consultation. Or you can message us on Facebook. We look forward to hearing from you. Take care.